CNA Patient Autonomy Explained. Welcome to the quiz. Question 1. You are assigned to provide catheter care for Mrs. Christine Foster, a 75-year-old female patient who has an indwelling urinary catheter. You understand the importance of proper catheter care in preventing infection and ensuring the catheter remains functional. You are performing catheter care as instructed by the nurse. Based on proper technique for providing catheter care, which is the correct procedure? Option A. Use the same washcloth for all patients to save time and supplies. Option B. Clean from the catheter insertion site outward along the catheter using a fresh section of cloth with each downward stroke to prevent pulling bacteria into the urethra. Option C. Clean from the patient's body outward and then back toward the catheter insertion site, since this direction is easier. Option D. Only clean the tubing of the catheter without cleaning around the insertion site. The answer is B. Catheter care requires cleaning from the meatus outward, using a clean section for each stroke to avoid introducing bacteria. Option B is correct. Option A. Cross-contamination. Option C. Cleaning toward the insertion site pushes bacteria toward urethra. Option D. The insertion site must be cleaned. Question 2. During a staff meeting, your nursing manager is discussing patient rights and the ethical obligations of healthcare providers toward patients. She is asking staff to identify which statements accurately reflect patient rights in healthcare. Based on understanding of patient rights and ethical principles in healthcare, which statement about patient rights is accurate? Option A. Patients must follow all staff directives and orders without question, even if they disagree with the treatment. Option B. Patients have the right to accept or refuse treatment after understanding the consequences of their decision. Option C. Patients must accept all recommended treatments and cannot refuse any aspect of their care. Option D. Patients cannot make decisions about their own care. These decisions must be made by healthcare providers or family members. The answer is B. Patients have the right to informed consent and refusal. Option B is correct. Options A, C, and D violate patient autonomy. Question 3. You are meeting Mr. Donald Garcia, a 70-year-old male patient, for the first time as his primary care assistant for the shift. You want to make a good first impression and establish a positive therapeutic relationship with him. You approach his room with a professional demeanor. Based on best practices for establishing therapeutic relationships and greeting patients professionally, how should you greet a patient to establish a positive therapeutic relationship? Option A. Minimize your greeting since you are busy and there is not enough time for extensive conversation. Option B. Identify yourself by your name and title, address the patient respectfully, and greet him warmly to establish a positive interaction. Option C. Use informal language immediately to make the patient feel like he is your friend rather than a patient. Option D. Make comments about the patient's physical appearance to help him feel welcome and comfortable. The answer is B. Introduce yourself, your role, and greet the patient respectfully. Option B is correct. Option A is rude. Option C is unprofessional. Option D. Comments on appearance may be inappropriate. Question 4. You are beginning your shift and reviewing which patients are assigned to your care. One of your assigned patients has a light on his call bell, indicating that he is requesting assistance. Based on appropriate response to patient requests and promoting patient satisfaction, what is the first step in responding to a patient call light? Option A. Continue with your other tasks and respond to the call light whenever it is convenient, even if it takes a long time. Option B. Answer the call light promptly and assess what the patient needs. Option C. Ask another patient to go check on the patient who is requesting help. Option D. Ignore repeated calls as they may indicate the patient is just seeking attention. The answer is B. Call lights must be answered promptly to ensure patient safety and satisfaction. Option B is correct. Options A and D are neglectful. Option C is inappropriate. Question 5. You're assisting Mr. Edward King, a 66-year-old patient who appears to be experiencing significant pain. His facial expression shows grimacing, his body appears tense, and he is holding his abdomen. He tells you that he is experiencing severe pain in his abdominal area. You understand the importance of addressing patient pain concerns. When observing a patient who appears to be in pain, what is the best action to take? Option A. Assume the patient will manage the pain independently without help. Option B. Give the patient pain medication immediately without involving the nurse. Option C. Ask the patient about his pain, listen to his description, and notify the nurse immediately so that assessment and treatment can be provided. Option D. Assume the patient is exaggerating his pain and that it is not as serious as he claims. The answer is C. Pain must be assessed and reported. Option C is correct. Ask, listen, and notify the nurse. Option A and D dismiss the patient. Option B. CNAs cannot administer medications. Question 6. You are caring for Mrs. Constance Phillips, an 82-year-old female patient who has just been told that her cancer is terminal and that her doctors estimate she has only a few months left to live. She is understandably upset and is grieving about her prognosis. She has asked you to sit with her and listen to her concerns. How should you handle caring for a patient who has received news of a terminal diagnosis and is dealing with end-of-life issues? Option A. Avoid the patient and try not to interact with her, since her condition makes you uncomfortable. Option B. Tell her about other patients with the same condition to help her feel less alone. Option C. Provide empathetic and compassionate care, allow her to express her feelings, listen without judgment, and support her emotional and physical needs. Option D. Change the subject whenever she brings up her condition, trying to redirect her thoughts to more positive topics. The answer is C. Patients at end of life need compassion, presence, and emotional support. Option C is correct. Options A, B, and D are dismissive and inappropriate. Great job! Don't forget to subscribe. Bye.